Hello guys, today's topic we are going to talk about placenta previa, and this is the implantation of the placenta at or near the cervix. It is mainly characterized by bright red vaginal bleeding without pain during pregnancy. And here are the types of placenta previa. Type 1, which is low-lying. The major part of the placenta is attached to the upper segment and only the lower margin encroaches to the lower segment but not up to the os. Type 2, which is marginal, the placenta reaches the margin of the internal os but does not cover the os. For type 3, it's called incomplete or partial central, where the placenta covers the internal os partially. And lastly, type 4, which is called central or total, the placenta covers the internal os even after the cervix is fully dilated. And here is about how to diagnose placenta previa. Number 1, you must note that first, if you suspect placenta previa, do not perform a vaginal examination unless all preparations have been made for the immediate cesarean section. Then, perform a careful speculum examination to rule out other causes of bleeding such as cervicitis, trauma, and cervical malignancies. Do an ultrasound examination in order to localize the placenta implantation site. Then let's go to management of placenta previa. Number 1, do a rapid assessment of the maternal and fetal condition and do the resuscitation if necessary. Number 2, restore the blood volume by infusing IV fluids like saline and Ringer's lactate. Number 3, do a cross-matching and prepare for the blood. And if the bleeding is light or if it has stopped and the fetus is alive but premature, consider expectant management until delivery, where you keep the woman in hospital until delivery and correct anemia with or iron therapy or by blood transfusion. Then give the anti-Ds if the matter is rhesus negative. If the bleeding is heavy and continuous, arrange for CS delivery irrespective of the fetus maturity. For those with major placenta previa, that is type 3 and 4, where the placenta is within 2 centimeters from the 2, restore internal os and head is high, consider hospitalization from 34 weeks gestation and prepare for CS. For those with moderate placenta previa, which is type 1 and 2, where the placenta implantation is about 4 centimeters from the internal os and the head is low, prepare for vaginal delivery. And if the fetus is less than 36 weeks gestation, give corticosteroids 48 hours before delivery to enhance maturity of